Welcome to For the Health of It, an intimate look at public health in Cowley County, Kansas. Join us as we discuss topics that are impacting public health in our community and learn about what we do at your local health department. Welcome again, everybody, to another edition of For the Health of It, where we discuss everything about public health in Cowley County, Kansas. I'm Tom Langer, the Public Health Officer and Administrator of the Health Department, and with me today, as always, is Allison. Allie, how are you today?
I'm well, thank you.
Allie, tell everybody what it is you do here.
I am the Assistant Administrator and Epidemiologist.
Exactly right. And today it's going to be very important that everybody understands what an epidemiologist is. So if we would take just a moment, give me that quick definition of what an epidemiologist is, especially in public health.
I'd say a simple definition is tracking diseases. We would be paying attention to their origin, their transmission patterns, and we would be attempting to identify other cases or exposures so that we could minimize the spread of whatever it is that we're concerned about.
Whatever disease is. And we are always focused on infectious disease. And one of the most, if not the most, highly infectious disease is what we're going to be talking about today. And that most contagious virus is
Measles.
Measles. In case any of you have been sleeping for the last few months, you will know that there are measles cases in the United States and that they have, in fact, affected the state of Kansas. As of the time of this recording, we've not had any confirmed cases in Cowley County, but everybody is talking about it, concerned about it, and I believe it's time that we have a candid conversation, and you're going to hear perspectives from a long and a broad spectrum, because I am an elder in the community, I guess you could say. I'm one of those baby boomers that was born before we had vaccines that helped us almost entirely eradicate measles in the United States. And so I am one of those people who lived through having measles not once but twice. I had the regular measles, and I also had rubella, which is also called the German measles, when I was a child. I am 66, going on 67 years old, and I remember it distinctly. So for all of you who think, oh, this is no big thing, let me tell you something. I recall it. I remember having it as a child. I remember the doctor coming to my house. I remember my mother having to be there and caring for me on a daily basis while I was sick. It wasn't pleasant. I was probably all of 4, maybe 5 years old, and I remember it distinctly. It was one of the worst illnesses that I ever recall having in my lifetime. So with that in mind, you're going to really understand where I'm coming from. I'm also a father of 5 children and several grandchildren now. And every one of my children and all of the grandchildren have been vaccinated against measles in a vaccine that they receive 2 doses of. It's an MMR. Allie, what's that stand for?
Measles, mumps, and rubella.
And rubella, measles, mumps, and rubella. It is a compound vaccine that is given at 2 times during their young lives.
Yes.
The first time is around 1 year.
Yes.
And the second one comes
about 4 years.
About 4 years. And when you have the first vaccine, you are protected to about what level, Allie? You remember? I know it's in the 90s.
Yes, about 92%.
About 92%.
Great protection.
And then when you get that booster or that second vaccine, it raises the level to?
97, 98.
97 to 98, which is really, really good for the most contagious childhood disease that we know of. Always has been, always probably will be on this planet. How contagious are the measles, Allie?
They are extremely contagious for those who do not have immunity.
Give us an example of how it's spread. Tell folks a little bit about that.
So it's a respiratory virus, so it's spread through the air, droplet transmission. But one thing about measles that makes it unique and less favorable is that it can actually survive in the air for up to 2 hours after the infected even leaves the room.
Exactly right. I mean, somebody could be in a room, they could cough or sneeze, and then leave, and within 2 hours, somebody else could enter the room and contract the illness.
Right.
That is how contagious this is. We always talked about the R-naughts. You remember the R-naughts?
Yes.
Those are for those of you that haven't gone through any kind of public health training, it basically is it's the measure of how contagious an illness could be. And an R naught basically will say, well, if you have one person who has the disease and is surrounded by others that have not, the probability of the people, say a group of 10, you will have 8 out of those 10 people come down with the illness if they are around that child for any length of time. Just that's how contagious this is. It's a really, really high factor. So we've established a couple of things. Number one, that measles is a serious disease. Tell us a little bit about what the symptoms are, Allie, and what happens to an infant or to a child when they get sick.
Okay, so the measles infection, it's a systemic infection, and so it impacts multiple organ systems. The incubation period, or the time that it would take from you to be exposed to when you might have symptoms, it's 11 to 12 or so days. Around day 14, you might have the famous measles rash. What that means is it's a rash that generally starts on the head and face area, and then it ends up spreading downward on the body and outward to the hands. Other things that can accompany that rash would include a cough or a runny nose, itchy eyes, those types of things consistent with a respiratory infection.
What about a fever? Is it usually accompanied by a fever?
Yes. In fact, it's accompanied by a very high-grade fever that can sometimes get up to well over 100 degrees Fahrenheit, 105 even.
Right. Over 101 is not uncommon with the measles infection. What other kind of things does the measles cause when we've talked about, of course, you're going to have a child that's going to be exceptionally uncomfortable. They're going to not even be comfortable in their own skin. And they're going to have a fever, and they're going to be clingy, and they're going to have runny nose and the watery eyes and the coughing and the sneezing. But what happens to them on the inside of their bodies when they get infected with the measles?
Well, they can be impacted with the Koplik spots in their mouth. The white spots in their mouth will be pretty early, but then there are some other consequences that are much worse, including pneumonia and even encephalitis, or inflammation of brain tissues.
Right. These are the things that basically lead to hospitalization, and in some severe cases can ultimately end up in the child's death.
Yes.
Do you recall what before the vaccine, Allie, what the numbers were in the United States for how many kids would get the measles on an annual basis? I think it was 1 to 2 million cases per year.
Yeah, that sounds right.
And out of all of those cases, you would have between 4,000 and 5,000 that would end up in hospitals. So we're talking 4,000 to 5,000 children ending up in the hospitals. And of that, we would have 400 to 500 deaths.
It's terrible.
That's terrible. And it was eradicated. I mean, we know that the vaccines that we have today absolutely can inhibit this and basically keep it from happening, prevent it from happening. And the problem that we've got right now is that we're seeing it come back. I've been in the community for 10 years as public health officer. I have always told people, I'm not going to lie to you. I'm going to tell you the truth. I'm going to tell you how it is.
Right.
When we have something that will not harm your child, it will not kill your child, it's not going to give your kid another type of illness, it's not going to cause them to have autism or anything else. There's no proof to that whatsoever. But what it does have is decades and decades worth of proof showing that it is effective and it solves the problem for which it was designed. Why are we seeing cases of measles now?
People are not getting vaccinated.
They're not vaccinated, or they're choosing not to have their children vaccinated.
Yes.
That is it.
That's the most common theme. In 2000, actually, in the United States, we had gone over 12 months within the country without having any new cases identified. So it was said that measles in the country was eliminated. But with any type of disease that is eliminated, it just means that it's specific to a geographic region for a specific time. The United States considers a 12-month period. But even with that elimination, everything in public health says you have to continue with the methodologies that you use to get to that point.
That's right.
And those were the vaccinations, and we've let up over the years. And now we are starting to see measles reemerge in several different states in the United States.
I know we have seen the news out of counties in the western part of Texas, which is up in the Panhandle area. And if you know anything about the geography of the state of Kansas, if you take a look out in the southwest corner of Kansas and along that southern border, we have a stretch of, I don't even know how long or how wide the Panhandle of Oklahoma is. It's probably no more than 15 miles wide. What do you think?
Yeah, it's very
It's not very
small.
far. It's a sliver. Okay, like it's that Panhandle. It's actually it is. So we're not far from Texas in that part of the state.
No.
And we think about driving down through south central Kansas and having to go all the way through Oklahoma before we get to Texas. But the way the state is shaped, for us to get to where the epicenter for the current outbreak is, it's not far from the state of Kansas. And I know that in the county, what are the counties in southwestern Kansas that have it right now?
Morton, Stevens, and Grant.
Grant counties. And if anybody wants to take a look at the Kansas map, they'd be able to see that. But here's the thing. It does not take very long for that to spread. And it does not take long for people to move, from that part of the country to, have to make a trip, say, to Wichita, or they have family in, oh my goodness, the Winfield area, or any place around here. And we talked about how easy this is to spread. It does not take long.
Well, and you know
before
what
it will
last
pop
week
back up.
was?
Last week was, I think, spring break for
Right.
folks? Yeah, so we
Right.
had people out and moving around and doing things. And so I know it's always one of those deals where I remember, when it was 2025? I remember 5 years ago at spring break. I wish I could forget it, but I can't. People went away real happy and smiling. Oh, what's this thing we're hearing about? Oh, don't worry about it. And then while you're on spring break, all of a sudden things start closing down, and COVID was here. Now, this is a situation where measles has been here a long, long time. I mean, as far as its existence, it's never going to go away. Just like all of these viruses, once they get into the human population, they begin to circulate. But the thing about this is that it's totally unnecessary, and it just makes me weep for those kids, the babies specifically, that have to go ahead and suffer simply because all of a sudden this has become kind of in vogue to say, oh, I don't think I want to have my children immunized.
Yeah,
Let's
it's
talk
almost
about that.
trendy.
Trendy?
Yeah.
You know what's trendy? Trendy is one of those little dogs that you can put in a purse. That's trendy, okay? Trendy is wearing, colorful sunglasses. Trendy is doing TikTok videos and those dumb TikTok challenges from several years ago. That was trendy. Not immunizing your children is not trendy. It's just plain stupid. And I don't, and people can be mad at me. That's fine. I've got big shoulders. I can take it. But why would anybody not take the opportunity to immunize their children and save them from suffering? I think this is part and parcel of why people haven't done it. They have not lived through it. They don't know what it's like.
Yeah, the vaccines have done their job.
And maybe it's done it too well.
Maybe.
I don't know, but it's just...
Yeah, my generation we were all
You've not had
vaccinated, and now my
not had it.
generation are becoming parents.
Uh-huh.
And
Nope.
we are the ones who are not having our children vaccinated.
And to me, it defies logic. It's like, oh, I'm going to buy a brand new car, and I'm going to drive it, but I'm never going to change its oil.
Right.
You know what? I don't have to change it. So I think that's kind of dangerous to the environment if I change oil. And then I have this old waste oil, and I'm just not going to do it because I just don't think I need to. And then all of a sudden your car locks up on the side of the road and it blows an engine. Now, same kind of logic goes into this. I mean, and I know that there are people that say, well, I have a fundamental objection. And that's great. I appreciate that. And I appreciate you. And I respect you and your fundamental objection. But I have an objection to you allowing your children to get sick. It's contrary to what I believe as a parent and what I believe as public health official. So you're going to say, well, it's maybe my religious right, or it's my religion says I shouldn't do it. I'm like, fine, I get that, and we do see this happen
Right.
in a lot of these sects like that. But what we're seeing happen more and more is what I call a spillover or a blowback from the vaccines that were developed before the pandemic and people still being now angry, and they maybe had a little bit of an idea before that, oh, I hate having to watch my child get a little needle put in their arm and they cry for 2 or 3 minutes. It just breaks my heart. I can't do it. Therefore, I just think I'm going to object and I'm not going to vaccinate my child. And you are absolutely putting your kids at risk because you make that little trendy decision. Don't do it. Now,
I mean, I understood.
How do people? Let's talk about it. How do they know if they have a record of vaccinations or not? Because we've got to talk about people that are older too.
Sure.
I got to talk about folks in my age category.
Okay.
Before we had the vaccine. Okay. When did the vaccine get developed? It was
1963.
Early 60s. So we know that if you were born before that, you didn't get it.
Right.
And I've always wondered why it is that they say, well, now they haven't adjusted the years. They say if you were born before 57, you likely have immunity. Well, I was born in 59.
Yeah.
And I know I've had it. Mm-hmm. And I know that having it has provided my body the immunities for that. So I am not currently worried that I personally will contract the measles. But I think folks need to understand that if you are in your 60s, especially 65 and older, you're likely safe and you do not have to be worried or freak out about the measles coming back. Would you agree with me?
Yes.
Now, what about a person that's immunocompromised?
Yeah, they might have a little bit more to worry about.
Right. In a situation like that, if they're immunocompromised, they may be a candidate for a booster dose of MMR.
Yes.
Would that be correct?
Yes.
Right. One of the reasons we don't want to have a whole lot of, folks my age and older, because we worry a lot about our health. It's just, as you get older, you start worrying if this car going to make it to the finish line. Well, it is. We just don't know when the finish line is coming up. So the thing I'm going to say to the older people listening in the audience is that don't freak out. Give the health department a call. We can chat with you if you do have a situation where you feel you may be compromised, in an immune fashion. We can chat with you and we probably can assist you. I don't know, being, Medicare eligible, if it is a vaccine that's covered under our healthcare plans now, because it's a childhood disease. We're going to have to check. We're going to have to check with our folks to see if the plans that we have, if the MMR is even on the formulary for somebody over 65.
Right.
I don't know. Good thing for us maybe to take a look at and research. But what about others? What about other adults who did not get vaccinated when they were children?
They definitely should become vaccinated now.
Right.
And for most adults, actually just one dose would give them that full coverage that they would need.
One dose is enough.
Yes.
Okay. So do we have any age categories there or any kind of classifications as to when we would take a look at it? We talked about the kids.
Right.
Okay. And let's talk about children again and when they can get it. So what if we have some children that are not vaccinated now, or mom and dad doesn't know? How do they find out?
A good start would be to give the health department a call, and hopefully we can locate that immunization record and we can go from there.
And what happens if they're not? What? Say I've got a 6-year-old and that child I know didn't get vaccinated. What happens? What do we do?
We would go ahead and initiate that 2-dose series. Go ahead and schedule an appointment, get you in and out, and you can have coverage for that kiddo very quickly.
What's the spacing between those two?
For a child that's older like that, we would do them about a month apart.
Okay. And that would bring them up to that level.
Yes.
What about if we have children in school and they're exposed, and the ones that have had their shots, what happens to them?
They're going to get to remain at school as long as they don't have symptoms, because we assume they have that immunity and it's safe for them to do so.
So they're good. Mom and dad don't have to worry. They don't have to
Correct.
stay home for 3-4 weeks and attend to sick children. What about if we have a case in a school and your child hasn't been immunized. Do you know what's going to happen then?
Yeah, that kiddo is not going to get to stay at school and is going to be excluded for a minimum of 3 weeks. That 3-week period is going to be what we would consider the length of time for incubation, so about 12 days. And then also, on top of that, the time that someone would have symptoms should they become infected, because we have to make absolute certain that they can't come back.
Now, I need you to slow that down
Okay.
and say it all again.
Okay.
A child, let's say a first grader that's 6 years old, right?
Yep.
Has not had measles vaccination.
Okay.
Okay, we're going to say little Tommy comes to school and he has been exposed and he has it, but he's not developed symptoms yet, but then he does. And so now he's been in that classroom with little Allie,
Okay.
who also has not been vaccinated.
Okay.
Tommy's got it.
All right.
Okay. And all of a sudden he gets, the fever and he has to stay home and the rash and it gets tested. And measles is one of those diseases that when we're tested for it, it is so important that the lab has to report it to public health within 4 hours.
Yes.
4 hours. You got to remember back with COVID, it was a 24-hour reporting period. Here it's 4 hours. That's how bad it is and how much we need to know about this as quickly as possible. So anyway, so we know that this little Tommy's got measles and he went to school because he was feeling okay and mom and dad sent him, just a little runny nose or watery eyes. It's just allergies. It's no big thing. He'll be fine. And he gets sick, but he's been in that classroom all day.
Okay.
And little Allie is over there, and she's, now, I mean, they don't even like each other. They're 6 years old. They don't, play or nothing.
Sure.
But she's been in that room.
Yep. It didn't have her vaccine.
And she wasn't vaccinated. And then the test result comes back on little Tommy that he absolutely has the measles. And we set off the bells and the whistles and the sirens in public health, because this is now our issue and we've got to jump on it like a fireman with a hose. And what is going to happen to little Allie?
Allie's going home for
Allie's
3 to
gotta
4
go
weeks.
home.
Yeah.
3 to 4 weeks.
Or
what?
Allie could go get her vaccine.
Even
and
then?
she could go back. For measles, you certainly can.
Okay. So that's an interesting thing, isn't it?
Yes, post-exposure vaccination is still recommended for measles.
As long as she is not symptomatic.
Correct.
Okay. Interesting.
Right.
So listen up, Mom and Dad, because, you didn't like it when the public health officer said, you've got to stay home for 5 to 10 days when you've got COVID. We're talking 3 weeks, 21 days, maybe longer in this situation. And if you have other individuals in the family, they may be affected too.
Right. And with our school systems especially, I mean, we're talking about first graders, they're going to potentially exclude siblings and things too.
Exactly right. So I really do want to make sure everybody understands this is one of those things I always hope and pray never happens. This is why these school-required vaccinations are so terribly important. I would really hate to see our springtime now and all the things that happen in springtime. Do you remember in 2020 how all the sports seasons were canceled and the proms and the graduations and everything, where all those things got canceled? I don't want to have that happen to any one individual, let alone an entire community. And I certainly don't want any community in our county to be impacted by this kind of illness. But this is exactly what's coming. I spoke, and I think you went with me. There was a conversation that I had with a group, a ladies group back in, was it February?
Yes.
And we were talking about the different things, and politics came up, as it always seems to do anymore. And I'm going to tell you right now, there is nothing political about dealing with contagious disease. I don't have any room for politics. I don't care who is running the CDC. I don't care who the Secretary of Health and Human Services is. It doesn't matter. What matters is the lives and the well-being of the people that I have to serve here in this county. And to me, Nothing is more sacred than protecting those little ones. They're the ones that don't get to make a lot of decisions for themselves. And so we want them to grow up happy. We want them to grow up healthy. We want them to have every advantage that they can. I do not want them to have to suffer through childhood diseases like measles, mumps, rubella, typhoid, all of these things that we've done away with, tetanus, whooping cough, all of the stuff. We've worked exceptionally hard over the last 100 years in public health. And we've turned back a lot of the things that were killing people and causing our average life expectancy to be in the 40s. And we're not where we should be even now because we do a lot of things to ourselves. We smoke, we don't eat properly, we don't get enough exercise, we drink alcohol or other or sugared beverages to excess, all of these things. You hear about it all the time. But when I know that we have something that is 100% effective and it works, as these childhood immunizations do, I don't want to see kids going back into iron lungs. I don't want to see kids having these diseases. I have on my arm little marks. I mean, not little. They're little pock marks is what they're called from when I was vaccinated against smallpox. Now, smallpox is one of those diseases that's been eradicated, and it's been eradicated because of the fact that vaccines were developed and they were, guess what? Every vaccine at one point in time was experimental.
Of course.
It really was.
Yeah.
But the question is, this one for measles, it's not.
Not now.
Not anymore.
Definitely
This is not something brand new.
No
This
way.
is not, this isn't. This is tried. This is true. If you did not suffer measles, in your childhood, it's likely because your mom and dad made the decision to have you vaccinated. Do this for your kids. It's legacy, and don't sit there and say, oh my gosh, I just don't want my baby to cry. That child is going to do a heck of a lot more than cry when they get sick with the measles. And that's it. I mean, I can't say it any plainer than that. What do you have to say? What have I missed? Talk to people. Tell them about this, in the scientific realm, because it just, it really does. It angers me.
Sure.
And I don't like to be angry.
Yeah, no, I understand. I think it might be helpful to talk more about the vaccine. You've talked about it not being experimental and being around for decades, and it certainly has. You mentioned previously that measles is a 4-hour reportable and that measles has been around for a great period of time. Measles actually in the United States became a reportable disease in 1912. So to still be doing this in 2025 is somewhat sad. In 1963, the first measles vaccines were made available. There were 2 at the time. There was a live virus and there was a killed virus. Today, we just use a live virus vaccine. That vaccine has been available in its current form since 1968. It was combined with rubella and mumps in 1971. So we have been using these vaccines for 50 years. Longer
than a lot of people in the audience have been alive.
Yeah. Oh, yeah, definitely. I think that sometimes when people hear live vaccine, they maybe think that if they get that they are exposing themselves and that they are now going to get measles because they received a live vaccine, and that's just not the case at all.
How's it work?
So they're normally referred to as live attenuated vaccines, and attenuated is really just a fancy word for weakened. There are a few different methodologies for weakening a virus, but for measles specifically, this was done in a laboratory through a process called passaging, and it is just taking that virus and it is continuously passing it through different embryos in that laboratory setting so that each time it's passed through, the virus becomes more weak. And the purpose for doing that, of course, is, well, we want to have a similar impact as we would if we were to become infected. So it makes sense to use a live virus.
A lot of things, the other things, I've been thinking about as we've had the conversation. A lot of things hit today in the area of social media. I mean,
Yes.
look, we're doing a podcast. My goodness,
Yeah.
So, and we realize that, and we know that people will turn to that now. Oh, I'm going to get my news off TikTok, or oh, I'm going to get my news off whatever. Okay, off of X,
Yep.
or whatever I subscribe to and I read. This is where I get my news. I saw something that just made me absolutely shake my head and go, how silly. And that was a reference in the media to, oh, measles isn't so bad. Don't you remember back in the 70s that episode of the Brady Bunch? The Brady Bunch is not where I go ever to get my information about medicine or disease prevention. Sorry, folks. It was a fun sitcom, about a blended family. And, well, yeah, it's true that if one kid would get it and the others were not vaccinated in the 70s, which kind of makes me scratch my head because, they were a upper middle class family out on the West Coast that was very much making sure they did everything so that poor little Cindy, when she got the measles, and then all the kids stayed home and had the measles, they thought it was a great time and it was a party. There is some truth to the fact that back when I was little, okay, parents would have kids maybe purposely exposed because they wanted to get it done, although it didn't have to be purposely, not with the measles, more with the chicken pox.
Right.
Varicella was that way. You had, chicken pox, and I tell you what, varicella was no big was not a fun thing either. You get little blisters and pustules and your kids scratching them and their skin gets infected and they look absolutely horrible and terrible. I mean, it's been since the 90s, sometimes in the 90s, someplace in the 90s, that we finally ended up having a vaccine for chickenpox.
Right. 95.
Yeah, 95. I think my youngest two children, were eligible to receive that. Everybody else, they had to suffer through it.
Right.
Okay. Again, not fun. You and I were talking, and you said, Tom, there was you had mentioned that Brady Bunch deal.
Yes.
And you did, and did you do some research?
I did.
Tell me about that research.
Well, I haven't watched the Brady Bunch.
Okay.
So I had to start there. But I went ahead and started looking into that Brady Bunch measles episode. And I noticed that episode came out in 1969.
Uh-huh.
So the vaccine had already been in use for 6 to 7 years. And by that point in the United States, measles infections were already down by almost 90%.
Mm-hmm.
So I think it's fair to say that attitudes about measles in general had changed quite a bit in a relatively short amount of time.
Right.
So I don't necessarily think that the Brady Bunch episode was reflected of the severity of measles.
Exactly. Now, but there was another show, and for all of you that may be of my age and a little bit younger, you're going to remember the name of this program. There was another show.
Right.
Where somebody got the measles.
And that episode came out in 1958.
And it was?
Lassie.
Lassie. Do you guys remember Lassie? If you have any kind of, problems remembering back that far, Lassie was a collie that was owned by a farm family. And my goodness, 1958. I grew up on things like Lassie and Gunsmoke and all those cool shows that, So if you're old enough to remember those shows, you can absolutely remember what it was like to live in a world where we didn't have measles vaccines.
Right.
And that one wasn't quite so good, was it?
No, it wasn't.
Yeah, and the outcome wasn't quite so good.
Right. The episode itself was titled The Crisis.
The Crisis. Exactly right. And that's the thing. It's not, we're not making this stuff up. It just amazes me how silly we can be as human beings to forget history and to have lost sight of that. And so, sadly, I don't want to see any kids die. I don't want to see any kids get sick. I don't want to see any parents have to stay home for 2 to 3 weeks attending to their sick children. I certainly don't want to have to deal with those kind of. I don't want to.
Yeah.
Okay?
No, definitely not.
It's really bad for me to say that because. These are the things we should sit there and look at. Oh, look, Allie, we've got job security here. No, I don't want that job security. I don't want to have to be dealing with this crisis.
Right.
Not for anybody in our community. So, What else is there that we can say about this?
I think that we should say that if your child has a rash, that does not mean that it's the measles necessarily.
Exactly. Right.
The only way to diagnose measles is to be tested for measles.
Okay. And
you have to be tested for measles with your physician in a healthcare setting. Those tests are mostly done with the nasopharyngeal swabs that everybody really loved in the midst of the pandemic. Those are the swabs in the nasal passages that go up quite a ways.
Right. Do we do that at the health department?
Yes, we can.
We can. Yeah. We don't like to. We don't do it. We recommend that you go see your physician first.
Right.
Okay. That has always been historically the way that this would work.
I also recommend that if you suspect that that's the case, that you would give your primary care physician a call and explain that situation instead of maybe just walking in and
right, exposing everybody in a waiting room or anything else. We do want to recall, or we want to talk about the things that we did learn as a community during the pandemic. Those little things that have four wheels and they're made out of metal and that we move around town in. Our own little cars and such, they are fabulous devices to keep us away from others.
Right.
And I will be honest that if we do have to start testing on a larger scale for measles, it will be in a drive-up basis once again.
Of course.
Where we would have come by with the child and we would do that. But you'll have to call ahead and you'll have to make those appointments. It's not just something where you can swing by. It's not like ordering a hamburger from McDonald's. No,
right.
You gotta let us know in advance. I'm sad that we even have to be talking about this, especially since I know that we've got, the vaccines that are safe and they're not going to kill you. In fact, it's the furthest thing from it. It will protect you, could save your kid's life. If you're thinking about it, if you're thinking, oh, it's really kind of, it's really trendy, and I want to be one of those ones that says, no, I'm not going to do this to my child. Stop. If you didn't have it as a child, thank your mom and dad and do that same thing for your children. That's really all I've got to say. Get off the stick. This is nothing to screw around with. Get your kids vaccinated. These childhood illnesses, one of the wonderful things about living in today's world is that we can control them and we can actually eradicate them for the most part. And it doesn't mean anything to hear those words until it's your baby,
right.
Until it's your child. And then it's too late if they catch it. Okay, so what else do we need to say?
I think that was a good bit of information for today.
Yep. I'm going to look over at Daniel. Daniel, we're probably right up on our timeline, aren't we? Yeah. So we get up there about this point. We've said it all. Again, I apologize if I've upset anybody out there. I really do. I don't want to do that, but on the other hand, there are times when I do have to stand up and scream, do the right thing. And right now, the right thing, if you have not done so, is get your children vaccinated. Okay? It doesn't matter. This is not political. This is all about their health. This has been about the health of generations of people previous to you. And if you're a parent right now and you've got a little one and you're thinking, oh, I just don't want to, get over yourself and get that child vaccinated. That little bit of a cry when we do that real quick is nothing compared to what they would be going through if they get sick with something like the measles, the mumps, rubella, any of those things. That's all I've got to say. So, until next time,
get your vaccines and stay well.
Stay well, everybody. Thanks for listening. Thank you for joining us for this edition of For the Health of It, Cowley County. We hope you found it useful and that you'll tell your friends and give us a listen again during future episodes. As always, we end today's segment by replaying a recent Public Health Minute, which is a weekly radio message focused on keeping you healthy. So, until next time, stay well, everyone. What would you do if a tornado hit your town? Would you have a place to shelter? Do you have an evacuation route? How would you stay informed? Does your home have enough supplies to last through a power outage? What's your plan for getting in contact with your family? Tornado season is here, and we at your local health department want you to ask yourself these questions before disaster can strike. Figuring out the answers is a key part of emergency preparedness. Having a plan in place and knowing what to do can keep you and your family safe during an emergency.
So here's a few tips for creating your emergency plan. First, be sure to include important information like contacts, nearby shelters, and evacuation routes. Next, make sure everyone in your household is familiar with what your plan is and knows what to do in the event of an emergency. Finally, make sure you practice your plan. Practicing your plan is the best way to find out what works and what does not. Learn more about preparedness by contacting the health department or by visiting ready.gov. Helping you prepare for tornado season. It's just another way the health department works hard every day to help you stay well.